Bismillahirrahmanirrahim. Quote of the day: happiness is found when you stop comparing yourself to other people. Today, topic of my presentation is minerals, that is magnesium, iron, iodine, and fluoride. And I am presenting this under supervision of Professor Dr. Sarabzal. Learning outlines are introduction to magnesium, iodine, iron, and fluoride, their sources, functions, and deficiency disorders. Learning outcomes. At the end of presentation, my colleagues would be able to describe different aspects of magnesium, iron, iodine, and fluoride. Now, first, magnesium. Magnesium is an intracellular cation that comprises of 20 gram of human body. 75% of it complexes with calcium. Daily dietary requirement in men is 400 milligram per day, in women 300 milligram per day. And if daily oral intake exceeds 600 mg, then it leads to diarrhea. And if IV intake exceeds to 600 mg, then it leads to CNS depression. Now, these are the common magnesium-rich foods, that is almonds, spinach, soybeans, avocados, potatoes, brown rice, cashews. Now, absorption of dietary magnesium, it occurs through proximal renal tubules. Normal serum magnesium concentration is 1.8 to 2.2 magnesium per deciliter. Ionized magnesium is comprises of 60%, protein bound magnesium is 30%, and magnesium bound to other ions is 10%. Homeostasis is maintained by kidney. Absorption occurs through carrier protein, that is parathyroid hormone, increases absorption of magnesium. Now, functions of magnesium. It functions as activator of enzyme alkaline phosphatase, hexokinase, fructokinase, phosphofructokinase, adenylate cyclase, CMP-dependent kinase. It decreases neuromuscular irritability. It plays role in insulin sensitivity. Magnesium supplementation increases glucose tolerance, and magnesium deficiency decreases insulin-dependent uptake of glucose. Magnesium helps to control cholesterol level. Now, functions of magnesium metabolism. On a cardiovascular system, it has a blood pressure lowering effect. It reduces heart rhythm problem. In muscles, it contracts calcium, inhibits the overexcitability of muscles. It reduces cramps. In nervous system, it reduces excitability of nerve cells. It has a calming effect. In metabolism, it is essential for energy metabolism, and it is important for protein synthesis. Now, magnesium deficiency. Now, what is hypomagnesemia? When serum concentration of magnesium falls below 1.7 milligram per deciliter, then we label it as hypomagnesemia. And the common causes are diabetes mellitus, chronic alcoholism, liver cirrhosis, protein caloric malnutrition, diuretic therapy, hypocalcemia, or hypokalemia. Deficiency manifestations are neuromuscular irritability, tremors similar to hypocalcemia, carpopedal spasm, cardiac arrhythmias. Other common symptoms are muscle cramps and muscle pains, osteoporosis and fibromyalgia, headaches and migraines, gastrointestinal disorders, fatigue and tiredness, high blood pressure, irregular heartbeat, and insomnia. Clinical signs of hypomagnesemia are neuromuscular signs are muscle tetany, tremors, seizure activity, ataxia. In cardiac signs are electrocardiographic changes like peak T waves, mild ST segment depression, arrhythmias, ventricular tachycardia, torsidis de pointis, supraventricular tachycardia, atrial fibrillation, and electrolyte signs are hypokalemia, hypocalcemia. Now, magnesium toxicity. When the level is increased, that is above 1.7, then it leads to magnesium toxicity. These are the dose-related effects. When the range is 1.7 to 2.4, then that is normal serum level. And if it raises to 5 to 8, then nausea, headache, lightheadedness, cutaneous flushing. 9 to 12 magnesium milligram per deciliter leads to absent deep tendon reflexes, somnolence, hypotension. 12 to 15 sinoatrial and atrioventricular block, muscle paralysis, hypoventilation. And if the level raises more than 15 milligram per deciliter, then it leads to cardiac asystole, respiratory arrest, and coma. Now, there was a paper published in which it was summarized that recent advances support the link between magnesium deficiency, inflammatory responses, and diseases. According to it, low magnesium leads to chronic inflammation, leading to cardiovascular diseases, asthma, osteoporosis, neurologic diseases, mental health disorders, preeclampsia, metabolic diseases, and aging. And low magnesium also leads to hyperinflammation, leading to play role in sepsis and COVID-19. Then there were papers published about role of magnesium in COVID-19. According to it, it supports the expected efficacy of magnesium supplementation in the prevention and treatment of COVID-19 patients, especially pregnant women as well as subjects with hypertension and diabetes. Therefore, magnesium supplementation is expected to play an active role in clinical practice in the prevention and treatment of COVID-19. Then there were other papers that reported that magnesium shows the preventive effect on cisplatin-induced acute kidney injury in patients. In fact, magnesium deficiency is a common problem in diabetic patients. Magnesium deficiency increases the risk of poor glycemic control and diabetic retinopathy in a cross-sectional study including 250 diabetics in North India. And the recent study suggests that increasing intake of magnesium containing foods may help reduce the incidence and mortality of primary liver cancer. Now coming to other mineral, that is iron. Iron is one of the most essential trace element. The total body iron content is 3 to 5 gram. 75% present in blood. The rest is in liver, bone marrow, and muscles. Iron is present in almost all cells. Heme is the most predominant iron-containing substance. It is a constituent of protein or enzymes, hemoproteins, that is hemoglobin, myoglobin, cytochromes, catalase, xanthine oxidase, peroxidase. A non-heme are iron, transferrin, ferritin, and hemocysteine. These are the top 10 foods that are highest in iron content: fortified cereals, beef, shellfish, dried fruits, large white beans, spinach, baking chocolate, quinoa, white button mushrooms, squash, and pumpkin seeds. Recommended daily allowance in adult man and postmenopausal women is 10 milligram. In premenopausal women, it is 15 to 20 milligram, and in pregnant women, it is 30 to 60 milligram. Biochemical functions of iron. Iron is a component of several functionally important molecules. Iron is required for the synthesis of hemoglobin, myoglobin, cytochromes, catalase, and peroxidase. Cytochromes and certain non-heme proteins are necessary for electron transport chain and oxidative phosphorylation. Peroxidase, the lysosomal enzyme, is required for phagocytosis and killing of bacteria. Iron is also essential for the synthesis of non-heme iron compounds like succinate, dehydrogenase, iron sulfur proteins of flavoproteins, and NADH dehydrogenase. Iron helps mainly in the transport, storage, and utilization of oxygen. Iron is associated with effective immunocompetence of body. Now this is the picture that represents iron transport and metabolism. It is absorbed from the small intestine and it is bound to transferrin in plasma. In RBCs, hemoglobin is degraded by macrophages and free iron is released. And the excess iron is stored in tissues in form of ferritin or hemocysteine. Now, there are some factors that affect iron absorption. The factors that increase iron absorption are vitamin C, citric acid, gastric secretions, hydrochloric acid, acidic pH. And the factors that decrease iron absorption are phytate, phosphate, tannate, tetracycline, EDTA, milk, and alkaline pH. Now, storage of iron. Iron stored in the body as 65% carried by RBCs, 30% stored as ferritin in liver, bone marrow, spleen, 4% stored as myoglobin, that is skeletal muscles, and the rest is transit throughout the body bound to transferrin and iron binding proteins. Now, what is ferritin? Iron is stored in liver, spleen, and bone marrow in the form of ferritin. In the mucosal cells, ferritin is the temporary storage form of iron. Ferritin contains about 23% iron. Ferritin in plasma level is elevated in iron overload. Ferritin level in blood is an index of body iron stores. It is an acute phase reactant protein elevated in inflammatory diseases. Now, second is hemosiderin. It is another iron storage protein which can hold about 35% of iron by weight. Hemosiderin accumulates when iron levels are increased. Now, the difference between ferritin and hemosiderin. Ferritin is a protein shell packed with hundreds to thousands of iron particles. Hemosiderin is an aggregate of hundreds to thousands of ferritin particles plus amorphous proteins and lipids. Both are super paramagnetic and collected by macrophages, glia, or RES cells. Excretion of iron. Now, iron losses occurs to faces exfoliating skin. Iron in males it is 1 milligram per day. In menstruating females it is 2 milligram per day, and persons with marked iron overload excretion is 4 milligram per day. Disorders of iron metabolism. Iron deficiency and iron overload are the major disorders of iron metabolism. Iron deficiency causes a reduction in the rate of hemoglobin synthesis and erythropoiesis. It can result in iron deficiency anemia. Causes of iron deficiency anemia is it is caused by inadequate intake, impaired absorption, chronic blood loss, and increased demand. It occurs in growing children, adolescent girls, pregnant and lactating women. Symptoms of iron deficiency, it is microcytic hypokalemic anemia in which the size of RBCs are smaller than normal and have much reduced hemoglobin content, weakness, fatigue, dizziness, and palpitation. Non-specific symptoms are nausea, anorexia, constipation, and menstrual irregularities. Now, this is to show the iron deficiency anemia. About 2 billion of the world's population are anemic. Anemia is more common in women than men, and global prevalence of anemia among women is 29% of non-pregnant women are anemic, and 38% of pregnant women are anemic. And children, anemia affects 43% of children globally. Coming to iron overload, hemosiderosis and hemochromatosis and iron poisoning are conditions associated with iron overload. Hemosiderosis, it refers to accumulation of hemosiderin in liver and other reticuloendothelial cell systems. There is no significant tissue destruction. Hemosiderosis is an initial stage of iron overload. Hemochromatosis. It is a clinical condition in which iron is directly deposited in the tissues, liver, spleen, pancreas, and skin. Hemochromatosis may be genetic or acquired. It is the other name for hemochromatosis is Bronze diabetes, in which the body absorbs excess iron from food. It is also called Bronze diabetes as it can lead to darkening of the skin and hyperglycemia. Now, there are two types of hemochromatosis, genetic or primary. It is a hereditary disorder due to an unregulated increase in the intestinal absorption of iron from normal diet. It is deposited as hemosiderin in liver, pancreas, heart, and other organs. After accumulation, excessive amounts of intracellular iron lead to tissue injury and organ failure. The other type is acquired or secondary hemochromatosis. It is caused by excess intake of iron, increased hemolysis, and is caused due to repeated blood transfusions. Hemochromatosis, clinical features. They are related to the involved organ system as follows. Liver, it leads to cirrhosis. In pancreas, leading to fibrotic damage to pancreas with diabetes mellitus. In skin pigmentation, bronze diabetes. The endocrine organs leading to hypothyroidism, testicular atrophy. In joints, it leads to arthritis. In heart, it leads to arrhythmia and heart failure. Iron poisoning. It is an acute overdose mainly occurring in children, may cause severe, even fatal symptoms due to toxic effect of free iron plasma, which may be life-threatening. Symptoms are nausea, vomiting, abdominal pain, and diarrhea. Prevention of iron deficiency. There are three ways to prevent. First is iron supplementation during pregnancy. According to WHO, 60 milligram elemental iron and 250 milligram folic acid daily for 6 months and additional 3 months in postpartum period in low prevalence countries. Treatment of hookworm infestation, single dose of albendazole 400 milligram stat or mebendazole 100 milligram BD for 3 days. Improvements of dietary habits, iron rich food, cook food in iron utensils. According to WHO, interventions like iron fortification is a very cost effective in areas of iron deficiency. It involves the addition of iron, usually combined with folic acid, to the appropriate food vehicle made available to the population as a whole. Cereal flours are the most common food vehicle, but there is also some experience with introducing iron to other vehicles such as noodles, rice, and various sauces. Prevention of iron deficiency anemia in infants and toddlers, breastfeeding for the first 6 months of life, iron fortified formula, iron fortified infant cereal beginning at 6 months of age, iron supplementation for preterm infants, iron supplementation for breastfeeding infants at 4 months of age. Avoid cow's milk before 1 year of age. Limit cow's milk intake to 18 to 24 ounces per day after 12 months of age. Now, there was a paper published by WHO that was there to assess the iron status of population. According to this document, it includes literature reviews on indicators of iron status, including red blood cell parameters, ferritin, free hydroxide, protoporphyrin, serum and plasma iron, total iron binding capacity, transferrin saturation, and serum transferrin receptors. According to this document, serum transferrin receptor levels combined with measurements of serum ferritin concentrations provide the most effective assessment of a population's iron status. Now, our next mineral is iodine. These are the food that are high in iodine: yogurt, banana, boiled eggs, salt, lobsters, baked potatoes, dairy products, dried prunes, cranberries, cheese, tuna, fish, and
फिर मैं अभी मुझे फोन कर दीजिएगा, मैं यहीं से आके ले लूंगी। यहाँ पे जा नहीं रहे, टायर पंक्चर हो गया है, सिर्फ पंक्चर लगवाना है। हाँ जी, वापस आएंगे।
According to WHO,
चाबी मुझे दे दीजिएगा।
In children 0 to 5 years of age, it is 90, and in 6 to 12 years of age, it is 120, and then it is increased to 250 microgram per day in pregnant and lactating women. Metabolism of iodine. Iodine absorbed from upper small intestine. Iodine is transported in plasma by loosely binding to plasma proteins. Iodine absorption also occurs through skin and lungs. 80% of body's iodine is stored in the organic form as iodothyroglobulin in thyroid gland. Iodothyroglobulin contains thyroxine, dihydrotyrosine, and triiodotyrosine. About 2/3 of iodine is excreted through urine, also excreted through bile, skin, and saliva. Plasma iodine concentration is 4 to 10 milligram per deciliter. Most of this is present as protein-bound iodine. Functions of iodine. The functions are in thyroid hormone synthesis, transport of thyroid hormone, indirect major role in body's metabolism, including fat, muscle, bone marrow, and breakdown. It increases heart rate, nutrient digestion, and absorption. Iodine deficiency disorders occurs either due to inadequate utilization, that is due to the presence of goitrogens in food, or through low dietary intake. Low dietary intake can be due to low consumption of seafood or due to low iodine levels in the soil and hence in the consumed food. The main deficiency disorders in fetus are abortion, stillbirths, congenital anomalies, increased perinatal mortality, increased infant mortality, cretinism, neurological and mixed edematous. In neonate, it causes goiter, hypothyroidism. In child or adolescent adults, it can lead to goiter, hypothyroidism, impaired mental function, iodine-induced hyperthyroidism following iodine administration. Now, what is goiter? When body don't have enough iodine, the thyroid works extra hard to make thyroid hormone, causing the gland to grow larger. Then the main food that acts as goitrogen means that they inhibit iodine uptake of broccoli, cauliflower, kale, cabbage, cassava, millets, and soya beans. This is the global prevalence of iodine deficiency. This dark purple color shows that these are the countries with severe iodine deficiency, and the light purple color shows moderate and mild iodine deficiency. Global Iodine Deficiency Disorder Prevention Day is celebrated on 21st of October 2020. Its main aim is to prevent iodine deficiency by eating rich foods in iodine, taking an iodine supplementation, and having iodized salt in small amounts. Levels of prevention. Primary level. It occurs through health promotion, that is health education, create awareness in high risk groups, educate people to eat iodine rich food, salt, and avoid glycogens. Environment modification, like fertilizers increase the soil iodide state, reducing iodine valorization loss by limiting the soil. Nutritional intervention occurs through food fortification, that is fortified salt, double fortified salt, spraying of potassium iodide solution on salt heap. Lifestyle and behavioral changes, that is through difficult, slow, and gradual process. Avoid glycogens, prefer iodine rich food. Specific protection occurs to specific diet, that is concentration of iodine at production level should be 30 ppm and at consumer level 15 ppm. Supplementation. Iodized oil injection, that is 1 ml gives protection for 4 years. Iodized oil capsules. Secondary prevention occurs through early diagnosis and treatment. Early diagnosis is we do through serum level of T3, T4, and TSH, urine iodine excretion, heel prick test in neonates for congenital hypothyroidism, and treatment occurs through medicals and surgical interventions. Tertiary prevention. It is a disability limitation, prevent the transition of disease from impairment, handicap like dyspnea, dysphagia, dysphonia through surgery. Rehabilitation through psychological support. Assessment of iodine deficiency. With regard to WHO global database on iodine deficiency and the measurement of iodine depletion, attention must be drawn to the following issues. It is important that each country carries out nationally representative surveys on a regular basis. Urine iodine is the most reliable indicator to assess, monitor, and evaluate iodine status in a population. At the assessment stage, clinical detection of goiter may be useful, but it should always be associated with the measurement of urine iodine. Neonatal TSH screening may be useful if a reliable system is already in place and the sources are available. Iodine Control Program in Pakistan. The Iodine Deficiency Project was a joint effort between the Government of Pakistan, UNICEF, and Population Services International in the early 90s. These three groups collaborated to tackle the issue which causes health problems such as goiter, cretinism, stillbirths, and deaf mutism. About 20 million people live in iodine deficient areas of Pakistan. Of these, 8 million show some manifestation of iodine deficiency and at least a million show some degree of mental retardation. Previous efforts to fortify oil with iodide had been met with limited success. The next simplest option was to fortify salt with iodine, successful but still could not reach the rural population. Laborers at salt processing plants with technical abilities to iodize the salt. Instead of focusing on the harmful and negative aspects of the disease, the campaign chose to concentrate on positive images. The main logo was hand and pot logo of this program. The goal of the campaign were to increase iodized salt consumption to combat iodine deficiency, as well as to create demand for iodized salt through social marketing while also increasing production. Now coming to our next mineral, that is fluoride. The top sources of fluoride are fluoridated water, fluoride toothpaste, food cooked with fluoridated water, beverages made with fluoridated water, salt supplemented with fluoride, food cooked with fluoridated water, dental products, fluoride containing drugs, exposure to industrial emissions, tea grown in fluoride rich soil. Now, recommended daily allowance for fluoride in infant, it is 0.01 to 0.5. In children up to 13 years of age, it is 2 milligram per day, and in adults, male ages 14 to 18 years, it is 3 milligram per day. In males over 18 years, it is 4 milligram per day, and in females over 14 years of age, it is 3 milligram per day. Functions of fluoride are formation of bones and teeth. It helps make teeth resistant to decay, and it helps make bones resistant to mineral loss. Fluoride deficiency. Fluoride deficiency may cause tooth decay, susceptibility to infections, curvature of the spine, weak eyesight. Now, fluoride toxicity. The effects may be acute or chronic. In a few acute effects, the nausea, vomiting, hypocalcemia, tetany, especially of hand and feet, hypotension, hypersalivation, mixed metabolic and respiratory acidosis due to failure of renal respiratory system, common convulsions leading to death. Chronic effects are dental fluorosis, skeletal fluorosis, hypersensitivity reactions, dyspepsia, gastric irritation, insufficiency of renal system, numbness, muscular spasm, birth defects, and cancer. Now, what is skeletal fluorosis? The symptoms are clicking or crackling sound, slow onset of these are the slow onset of symptoms, lower back pain, disrupted sleep, fatigue, depression, mood changes, stiffness, pain in joint, hips, knees, hands are most common, reduced flexibility, hard to bend down or climb style. These are all the symptoms of skeletal fluorosis that is due to the fluoride toxicity. Now, the treatment of fluoride toxicity, it can be symptomatic, that is, we give milk or egg or lime water, vomiting, so that majority of ingested fluoride is expelled. The treatment we do in hospital are cardiac monitoring, gastric lavage, and general supportive measures. The US Department of Health and Human Services announced a recommendation that community water systems adjust the amount of fluoride to 0.7 milligram per liter to achieve an optimal fluoride level to help prevent tooth decay. As the quantity is too small, but the public health benefits are big because water fluoridation children had about 3 times as many cavities. Now, dental caries and fluoride. Dental caries is a major public health problem globally and is the most widespread non-communicable disease. It is also the most prevalent condition included in 2015 Global Burden of Disease study, ranking first for decay of permanent teeth and 12th for deciduous teeth. Severe dental caries is a frequent cause of absenteeism at school or work. An association between dental caries and undernutrition in children had been reported in some low and middle income countries. Now, WHO response is it has made key policies that include taxation of sugar sweetened beverages and foods with high free sugar content, implementing clear nutrition labeling, improving the food environment in public institutions like schools, prioritizing awareness and access to clean water. Implementation of public health strategies to promote the use of fluoride should also be encouraged, although does not completely prevent dental caries if implemented as a sole action. Addressing the cause is therefore essential in preventing and reducing dental caries. Now, coming to MCQs. MCQs number 1. Diagnosis of iron deficiency can be complicated by concurrent infections since many markers of iron status are altered by infection. Which of the following combination of iron status markers is likely to be found in a person with both iron deficiency and a severe infection? Low hemoglobin, high ferritin, high serum transferrin receptors, high hepcidin. Low hemoglobin, low ferritin, high serum transferrin receptors, low hepcidin. Low hemoglobin, low ferritin, low serum transferrin receptors, high hepcidin, and low hemoglobin. Yes, right answer is because the main clue we have is high ferritin, and as we have discussed earlier that it is increased in inflammatory response. Also, this high hepcidin, it is also responsible for uptake of iron in the intestine, and in inflammatory condition, it is also increased. Presence of falling vegetables in diet can lead to formation of goiter except cabbage, cauliflower, broccoli, and spinach. The correct option is spinach. Others are goitrogens that inhibit uptake of iodine. Which of the following body parts is strongly dependent on the trace mineral iodine? Liver, thyroid gland, pineal gland, or
Thyroid gland.
yes, the correct answer is B. Iodine deficiency in a pregnant woman could result in cretinism, cryptorchidism, chronic hyperthyroidism, hypothesis. Yes, in pregnant women, it leads to the cretinism of children. The best indicator for monitoring the impact of iodine deficiency disorders control program is prevalence of goiter among school children, urinary iodine levels among pregnant
Neonatal
women.
hypothyroidism.
Yes, right answer is C, neonatal hypothyroidism. The practically because it is possible to carry out. Now, the other is MCQ number 6. Which of the following functions as a natural medicine for cholesterol, as it stimulates enzymes that lower bad cholesterol and enhances good cholesterol? Iodine, magnesium, iron, calcium.
Magnesium.
Magnesium.
Yes, right answer is magnesium. We discussed this functions of magnesium. The substance in the diet which inhibits iron absorption is tannate, vitamin C, sugar, citric.
A.
Yes, right answer is A, tannate. Others increase the iron absorption. The following is the most accurate estimate of iron stores in the body. Total iron binding capacity, serum ferritin, serum iron, hemocysteine.
Ferret-
Serum ferret.
Total iron.
Serum ferritin? Yes, right answer is serum ferritin. A child was presented in an OPD with complaints of dental caries, curved spine, poor eyesight. The most likely nutrient deficient is
Fluoride.
Fluoride.
fluoride. Yes, right answer is fluoride. Which of the following supplementation protects organ and tissue damage through anti-inflammation and antioxidation? Magnesium, iron, iodine, copper.
Magnesium.
Yes, the answer is magnesium. It is discussed in recent advances that it has role in chronic diseases as anti-inflammatory and antioxidative properties. This is the key. These are the references of my presentation. Thank you.
Thank you very much. Very nice presentation, Dr. Meha. However, I want to emphasize three important points. One is related with the public health problems that are strongly related with these minerals. Number second is that recent advances, and the third part is about your MCQs. So let's come to the first point, that is the public health interventions that are strongly recommended for these minerals. Let's take one by one all the minerals. First, you have talked about magnesium, and you must give us the public health problems that are being addressed by adding magnesium in our diet. We know that magnesium decreases the recurrent attacks of asthma. They are also very important whenever the cholesterol metabolism is concerned and the cardiovascular health is concerned. So according to the primary as well as secondary prevention, it is the important public health intervention that is being taken in account both for asthma as well as cardiovascular diseases. Now, second important point about iron is there are many fortification programs that are being run. You have not talked about any of these programs. One program is adding iron in the wheat, and that has increased the nutritional value of wheat. Most of the areas where the females, especially female of reproductive age, they were anemic, it has caused a lot of benefit to them because it is one of the very cheap and cost effective intervention that has decreased the anemia, low birth weight babies, and the fatigue and other problems in the pregnant females. Another important point is that iron fortification of milk, that is not recommended at all. It is against the public health laws, because we know that for the public health point of view, the fortification can only occur if that food synergize the effect of the other food. As we know that iron absorption, it is hampered by the absorption of by the taking of milk at the same time. So the fortification of milk, that is not one of a good intervention, because it increases the chances of enterocolitis or inflammation of the intestine that can lead to the bleeding of the intestine. And even these many children who have been given the milk that has been fortified with iron, with bleeding per rectum, or having very low hemoglobin because of the blood loss, and that continuous blood loss was in occult blood, that was not seen in the feces, but on examination through the microscope, there was microscopic picture of having bleeding in the feces due to the milk fortification with iron. So iron, it is not recommended to be added in the milk, and all those interventions that causes these iron to be added in the milk has caused more damage rather than having any good effect. So the public health practice should address all these issues. Third, you have talked about iodine. Again, one of a very important biochemical measure for measuring malnutrition is measuring iodine in the urine. You must talk about it. You have not shown us any of these important public health measures in your slides. I want you to please add all these slides because these are one of the very important issues in Pakistan. We know 44% of our population is suffering from stunting. So this stunting, it is not only the physical growth that is hampered, but the psychological or the mental growth is also hampered by the effect of stunting. And by measuring urinary iodine, many interventions can take place that can reverse the effect of stunting.
Okay.
In MCQs part, again, the public health scenarios has to be given, not only the stem. In most of the MCQs, only the sentence or the stem has been given and not any public health scenario or anything regarding it. So these are the few of my observations. Please add it. If anybody has any question, please do let me know. Okay, Dr. Meha, have you noted all those points?
Yes, ma'am. Ma'am, I shall add all these slides and
Slides
will upload.
right on public health scenarios, on
Yes,
research
ma'am.
advances regarding these minerals. And third, you have to make your MCQ scenario based and don't give only a sentence, but also give a scenario or a public health problem addressing that particular mineral. Thank you very much. And overall, it is a good presentation. presentation.
Okay, ma'am. Thank
Allah
you.
Hafiz.
Allah Hafiz.